Well, good afternoon, everyone. I'm Beth Stewart, Director for the Texas Oral Health Coalition, and I would like to welcome you all to today's webinar. The Coalition is very pleased to host today's webinar entitled Tech Talk, an Introduction to Teledentistry by one of our Coalition members, Ms. Amber Lavatos. Ms. Lavatos is the Clinical Director of Dental Services at Tamagua Healthcare Ministries, a nonprofit medical and dental clinic originally serving Tomball, Magnolia, and Waller counties, and have now expanded into parts of Montgomery and Harris counties. Amber is also an adjunct assistant professor at the University of Texas School of Dentistry at Houston, key opinion leader for Crest Oral B and Elevate Oral Care, government affairs consultant for Mouthwatch, and speaker. The honorarium for Ms. Lavatos is sponsored by Mouthwatch. TechSoc is awarding 1 hour for dental continuing education credit after attendees complete the brief online evaluation form. So with that, I would like you all to help me welcome Amber. And Amber, I've got the controls over to you now.
So thank you, all of you, for being here today during your lunch hour, or maybe you're already done for the week, so on your weekend. Excited to talk about my favorite topic, the teledentistry. I want to thank the Texas Oral Health Coalition for having this series. I think it's very important and very pertinent to what we're doing. So we'll get started. Some disclosures. I am the clinical director of dental services at Tamagua. We're a nonprofit. I'm a key opinion leader for Crest Oral B and Elevate Oral Care, and government affairs consultant for Mouthwatch. But I won't be discussing any products today, but I am sponsored by Mouthwatch. So our objectives. Today, we're just going to do a general overview over what teledentistry is, how we can use it, barriers, benefits. Next month, we'll discuss legislation, what that might look in different states, language, considerations for legislation. And then hopefully in March, there will be proposed legislation in Texas that we can discuss and dissect and see how that would fit for us. I hope that that's where we're going this year. So we'll start with the definition. I said before COVID, I really had to go into real big depth into what teledentistry is. I think there's a better understanding now for telehealth, but there's still some confusion. So in the basics, we talk about telecommunication. So communicating through technology, what we're doing right now, right? Communicating through Zoom. When you text somebody, you send them a written message, that's communication through technology. FaceTiming, emailing. If you've ever emailed a radiograph of a patient to another provider, that's telecommunication in dentistry. Essentially, that is teledentistry. Now in Texas, we are very blessed that we have telemedicine. And I'll say that telehealth and telemedicine, oh, my lights went out. So I'm not moving for an hour. So maybe you can see me. But in Texas, we've done a really good job about incorporating telemedicine. And they've done really good about really embracing consultations and exams. In dentistry, not so much. In dentistry, we've really wanted to do things. We're like, well, you have to be in person to do dentistry. But there are other forms that we can use it. Also say that telemedicine, they've done a really good job about direct to consumer. So telepsychology, right now, if you're somebody who's suffering from anxiety, you could download an app, you could fill out a questionnaire, tell them what you're suffering with, what kind of provider you're looking for, and they would connect you with somebody to get consultation from. Right now, I'll say like my dad is going through cancer treatment, and that's really difficult through COVID because most hospitals aren't gonna let you inside. But what's nice is that we can have a lot of post-ops that are virtual, that are video, that allows patients and caregivers to be connected and involved and still be safe. This is definitely where I think dentistry will go. I know in Texas, we're a little bit more limited and we haven't been able to do those things, but our patients are already experiencing this and expecting this. So incorporating it into dentistry is not going to be that much different. Telemedicine, they're a lot more advanced than we are, right? They've been doing it longer. They have a lot more technology. They have stethoscopes that connect to their electronic devices. So it allows a physician to listen to heartbeats, to breath sounds. We don't have that kind of technology in dentistry, but we do have other tools that we can use. So what is teledentistry? Teledentistry is the use of telecommunication or communicating through technology to exchange patient clinical information for dental consultations and or treatment planning, not just treatment planning. So the biggest misconception I hear is that people will say, well, they think that teledentistry is just exams. Teledentistry is not just exams. It is also consultations. It is referrals. It is screenings. It is any time you're using telecommunication in dentistry, that is teledentistry. So I'll hear people say, oh, I can't do teledentistry in my state. What they mean is they can't use teledentistry to perform an exam in their state, but they could still do it for consultations. They could still do it for screenings or referrals. And there's currently only one state that does not allow teledentistry at all. That is our great state of Texas. And I am a native Texan and I love Texas, but we're a little behind. And that has definitely been difficult during COVID. As director here at Tamagua, when the shutdowns happened in March, we were ready. I got some teledentistry technology, software, HIPAA compliant. We were ready to screen our patients to make sure that the patients we brought in were truly emergent, that we were being safe, that we didn't have PPE. So we just really wanted to be conservative. And then our hands were tied. We weren't allowed to do any of that. I had a person call me, a pregnant woman. She wasn't a patient of record, so we couldn't see her and we weren't seeing patients and we weren't taking any new patients. And she had a really hard time. She was low income, so her resources are limited to the community clinics in her area, but she couldn't find a dentist and she was in pain. And it was just really, really sad because I couldn't help her. And the sad part is she'll likely end up in the emergency room where we don't want them. Or we could have used telecommunication to assist this patient. So how does it work? So there's two forms of teledentistry, synchronous or asynchronous. If you've learned about teledentistry before, you've heard of these. So synchronous is real time, like we're doing right now. Me and you are talking. It would be either provider to provider. So you have an allied healthcare provider collecting the assessment data, radiographs, images, and then the dentist is viewing that data at the same time. Or it's patient to provider. So the patient sends you an image and you're video conferencing with them at the same time as you're reviewing the records. Or you would do asynchronous or store and forward, which is either the allied healthcare provider collects the data, sends it to a dentist, and the dentist reviews it at a later time. And the same concept with a patient, which it's really nice to have that kind of flexibility to be able to have the patient send you something and you review it later. So watch these videos, you can get an idea of what teledentistry looks like. We're not going to watch the whole thing though.
You may not be aware of this, but so what winds up happening is they have to travel 50, 60 miles.
Okay.
Amber, I'm sorry to interrupt.
Yes.
We're not hearing any audio.
No.
And since that was pretty much an online consultation, we can go right to Rochester and get the work done.
We tried this before we started and it worked. So I'm not sure what happened. But basically, you saw it was an allied healthcare provider collecting assessment data while the dentist viewed at the same time. And they were discussing the case. They saw that there was a resin on L. Then the mom discussed how this is really nice for her because she did an online consultation. She didn't have to take off from work and drive to Rochester to get a consultation, to come back home, to then have to come back again to get treatment. She was able to get a consultation in her community and then at a later time, go and see the dentist to get the care the patient, her son needed. Okay. Okay, so we'll talk about reimbursement because I know this is what people want to hear about is how they're going to get paid. So in Texas, we're not getting paid for teledentistry services. But if you're in another state, we're going to talk about this in an ideal world in the future. This is what we're going to be doing. So there are two codes, the D9995 code, which is your synchronous code. So if you did it in real time, like this dentist did, that's what he would bill for, or the D9996, which is the asynchronous code. So these codes are typically not reimbursable codes. I think Pennsylvania maybe has a small, like nominal fee that they'll pay, but typically it's just what you're telling the insurance on how you provided the care that you provided. So if you did a limited exam on a patient synchronously, you would do D9995 and the D0140 code, and they would pay you for the limited code. If you had a hygienist offsite collecting assessment information and you did the exam virtually, and then the hygienist did a cleaning, did a prophy, did fluoride, you would bill for the D1110, the D1206, the exam code, and then you would bill the D9996. So the insurance company knows how you provide the services, but you would only be paid for the procedures that were provided. And they would be reimbursed to the dentist, depending on the state that you're in, but typically reimbursed to the dentist, and then the dentist pays their employees. Now, pre-COVID, the majority of codes that were used were like that. They were usually in community health centers, public health areas, where it was a virtual dental home where hygienist was offsite collecting information, doing exams and cleanings, providing preventative care while the dentist provide the exam virtually. Now, when COVID happened, a lot of states where they didn't have legislation, and if you don't have legislation, it doesn't mean you can't do this, you can't use teledentistry. It just means that you likely won't be reimbursed for it. But when the shutdowns happened, insurance companies came out and said, we'll pay for some of these services. And the ADA has a really good guide. It's the ADA COVID-19 interim guide. And it has a list of insurance companies and what they said they would pay for. A lot of them said they would pay for the limited code. So if you're trying to determine whether this patient needs to come in or not, or if it's, patient really wants to come in this day, but you can't fit them in, they could do the limited exam. Or the reevaluation code. So if you did a limited exam and then you need to follow up on that limited exam, you could do the 0170 and it's reimbursable. Or if you did surgery and you need to do a post-op for that, you could do D0171. And the insurance companies were paying for this, except obviously not here in Texas. But that was really nice to be in states where even though they didn't have legislation, even though insurance companies weren't required to pay, they were still paying. The nice thing about having legislation is that typically in legislation will say that you have to be reimbursed at the same rate that you would reimburse if it was an in-person. Without there being legislation, they could pay whatever they want to pay. Okay, so how do we apply teledentistry? So in general, dentistry, we could do it for cosmetic consultations, right? You could collect the information and then meet with them virtually. And so I'll say that before COVID, a lot of dentists and practitioners were just real apprehensive about doing anything virtual, especially if it was just a consult, because they're like, well, somebody can just come in. But like we've learned, people are now accustomed to doing things virtually. Why should they have to take off from work to go see the dentist when they could do it virtually? They could do it during their lunch hour. It's partly convenience. It's also, currently we're trying to still social distance. We don't know how long this is going to go on for. So it also allows some safety. The virtual dental home was really the real popular thing that was done pre-COVID. Pre-COVID, we had hygienists off-sites doing assessments and doing cleanings. It's also can be done for specialty consultations and emergencies. I won't show you this next video because you probably can't hear the audio, but it was a patient in Minnesota who she had tooth pain and it was during the shutdowns and everything was closed. Nobody was open. And she was able to connect with one of the schools and get a virtual exam. So she did a teledentistry exam. They were able to give her antibiotics. And she says in the video that had she not been able to get in, she would have gone to the emergency room, which is where we don't want them ever, but especially not during COVID. So there is a tool, there is a need for teledentistry. So some examples of how it's being done. if you're in private practice, I won't talk too much about private practice. This is Texas Oral Health Coalition, so I'll talk more about public health, but it is being done in private practice prior to COVID, where this hygienist, she's from Access Teledentistry. She works with a dentist and their team. So she's in their office, their private practice office, and she collects the assessment information and sends it to her dentist, who does the exams virtually, and then provides cleanings. This allows flexibility for the dentist to have multiple practices, to do other things, to have hygienists in remote areas that maybe the dentist doesn't want to be or can't be. So it's been very popular with hygiene care. In this scenario, you'll have hygienists doing prophylaxis, sealants, SDF, especially if you need to do interim care. So if the patient needs to see the dentist, but they can't come in right away, the hygienist could apply SDF. And in Texas, hygienists are allowed to apply SDF. Fluoride applications. So I'll tell you kind of what a virtual dental home looks like. It looks a little complicated, but it really isn't. So you have an allied healthcare personnel on site, okay? They'll collect that assessment information. So whether this is an initial or periodic, they'll do radiographs, paracharting, images, videos, and they'll do one of two things. Either they'll collect it and upload it to a telehealth EHR for the dentist to view at a later time, or the dentist is viewing it at the same time, like we saw the video. If they viewed it at the same time, the hygienist can then go on and provide the preventative care that same visit, because that dentist is able to diagnose a treatment plan. So they could do a prophy, cleaning, sealants, and then they would determine, does this patient need to see the dentist or not? Is there a need? If there is, then the patient then travels to go see the dentist, or the dentist travels back to the remote location to do the care. If there isn't, then they continue on with preventative care. In the asynchronous version of this, the patient would leave. The allied health provider will collect the information. The patient leaves. The dentist reviews the information at a later time, and the patient comes back for their care. So it's multiple steps, like multiple visits for the patient, which isn't ideal, but it does allow the dentist some flexibility, because with synchronous, you would have to have the patient available, the dentist available, and the hygienist available at the same time. Versus with asynchronous, you would just have the patient and the hygienist at the same time, and the dentist can review these charts for patients, after patients, at lunch. So it allows for more flexibility, allows to reach more people and serve more people. So, but the drawback is also that you then don't have the opportunity to build rapport with the patient. And I do think that building rapport with patients is really important. Knowing who's providing care to them is important. But so give and take, right? So in public health settings, it's being done in school-based programs. A lot of school programs in other states are using it. For us, here at Tamagua, we do school visits. We do 4 school visits a year, and we haven't been to a school in a year now because of COVID. The last one was in February, and then we shut down in March. And so, we're not sure when we'll be able to go back to the schools. And so what happens to those kids? Who's taking care of those kids? Do those kids stop having cavities? They don't stop having problems. So our idea initially was, we could put intraoral cameras, we can get the nurses intraoral cameras, and we could connect them with telehealth or teledentistry platform. And then when they see something suspicious, they could take an image of it and send it back to our dentist here. Unfortunately, we can't do that. But how nice would that be? Or in between the times that we go visit schools, we go once a year to each school. Well, in between that time, they could send us images and refer patients to us and just have better collaboration. It's being done in a lot of nursing homes and community health centers. We'll go through some examples. This is in Oregon. So here we have hygienists who go to schools, and in the cafeterias, in the classrooms, they do things like they have portable equipment to take x-rays, take images, and they identify if there's signs of tooth decay. And if they need services provided by the dentist, then the dentist reviews this information, the hygienist provides preventative care. Now, it's important to consider scope. So teledentistry doesn't change your scope. In Texas, hygienists are allowed to do cleanings, SRPs, prophys, debridements, SDF, fluoride application, sealants. Teledentistry would not change what your scope is. If you weren't allowed to diagnose before, you're not going to be allowed to diagnose now. So in Oregon, hygienists are allowed to have their more expanded functions, so they can do other things that, say, a hygienist here in Texas wouldn't be able to do. And also supervision laws are different. So if you're in a state where your dentist has to be on site for care that hygienist provides, then teledentistry wouldn't work for you. In Texas, we have general supervision, so we could have a hygienist off-site and a dentist provide, after the dentist diagnosis, the hygienist provide the care. But if that wasn't the case, that would be something we would need to change. So school-based programs, I know some schools, what they were doing is they would send hygienists and they would just take intraoral images. And I think this one was done in Texas, where they had a dentist on site so they could do the exams, just so that hygienists could do the preventative care, but then they would send report cards home. So you can tell a parent, like, your child has a cavity, but instead they would take an image and show these images to the parent. And they found that they had more receptive and more people returning to receive the care because they could see it. It can be done for referrals. It's being done in Head Start. Colorado has a program where, and hygienists in Colorado are allowed to have independent practice. But in this scenario, the hygienist is an employee of a dentist. The hygienist does diagnose, determine whether the patient needs sealants, whether they need a prophy, fluoride, and then the dentist reviews that information. And if they agree that, maybe they don't need referrals, or they agree with the sealants, they don't have to come in. But if they disagree, then the patient comes in and sees the dentist. It's being done in labor camps. So Finger Lakes is an FQHC. And then when I was thinking about like places where we could do this, because really you could ideally be able to do it wherever you want to do it, I wasn't thinking about labor camps, but there is a need there, right? And so having allied healthcare providers going out into the fields. And so for me, one of the biggest barriers for our patients, one of the things that hurts my heart, is they'll tell me, like, I haven't worked in weeks. And now you're asking me to come in for this appointment. Well, I don't want to miss work. I can't afford to miss work because that's their living, right? We serve underserved people. So how nice would it be that we could serve them where they work, or serve them on their lunch break so they don't have to take off from work, so that they aren't losing income, so that, we're also helping them improve their overall life, right? We're not just here to, because we do want people to get out of their situations, to be able to not have to depend on our resources. But then we ask them to do things that is really difficult for them. In Pennsylvania, there is a dentist who owns a practice called Miracle Dental Associates, and she has her own brick and mortar practices. So she sees patients there. And so she has normal patients like a private practice would, but then she also has hygienists who go to schools and they do, and Head Starts, and they do cleanings, and then they refer back to her brick and mortar. And she's found that that's very profitable for her. But also it's serving the community, right? She has hygienists who she employs to go serve community members. I see I got some questions. You can kind of look at them later, maybe. Apple Tree, Beth and I were talking about this before we started. They're based in Minnesota. Minnesota has a lot of rural areas, just like we do here in Texas. And they do a variety of things. They also do Head Starts, but they also do nursing homes. So again, going to nursing homes, providing preventative care. And right now, especially during COVID, I have a friend who works, she's a hygienist and works for nursing homes, and she goes and does preventative care in the nursing homes. And she has to get COVID tested every 2 to 3 days. That's quite difficult, right? A lot of people don't have time to do that. But also when there's too many COVID cases, they're not allowed to go in. We could implement intraoral cameras in nursing homes and have the allied healthcare providers there take images and refer them back to the dentist if they see that there's something suspicious, the patient has pain. Even if we weren't just doing, we want to treat them everything. We want to provide preventative care, but if we could just provide emergency care for now, and there is a need. And what Apple Tree found was a lot of these patients are on Medicaid or Medicare and pays really low, and patients didn't have anywhere to go. And so with teledentistry, they were able to cut their costs and serve more people, even though they were getting reimbursed less. Okay, we'll talk about ortho. This is usually the really hot topic one, and what people are most concerned about. I will say there is some legislation that other states have passed that require in-person exams before a patient has clear aligners, which I think is a really good move. I think there's been also other proposed legislation to include verbiage when a patient is going to get clear aligners, the risks that they are running if they decide not to go through a dentist, because none of us want do-it-yourself ortho or do-it-yourself dentistry, period. We want to make sure that we're providing, yes, access to care, but also good care, quality care. I'll say here at Tamagua, we do provide quality care, good care. It's affordable care, but it's still, we don't reduce our standards to provide this care. So for ortho, it can be used for consultations, be used for minor emergencies, especially during COVID, right? Patient has an emergency. Are they truly emergent? Is it just really like rubber ligature displacement or cheek discomfort, something that's maybe normal and common? It can be used for phase 1 interceptive treatment. So if you want to consult, a general dentist wanted to consult with an orthodontist for specialty care, they could. This is Dr. Dan Bills. He's a board certified orthodontist. He's a graduate of Harvard, owner of Innovative Orthodontics. I presented with him at the Oral Orthodontics Association, and he's done some amazing things with teledentistry. Obviously not here in Texas, but what he does is he does all his consults virtually. So people, prospective patients will submit their information and he has a guide that he provides to them on what kind of pictures they want, what he needs to see, how to bite when they take the picture. They'll submit these images and he'll review them and then send them not a treatment plan, but just a guide as to what they might need and a range of what the cost is. And they do it all electronically through apps, HIPAA compliant, and it's been very successful for him. He doesn't do comprehensive exams virtually. So what he does this initial assessment, and then he'll tell them like what he thinks they might need, and then they can come in and they do a true treatment plan and go from there. And he says that this has been definitely profitable for him because a lot of times people will come in for consults and then never return. So the same thing with virtually, but he has a higher percentage returning. And so then that's not only good for, safety reasons, but for time management and for profitability. And I know that we don't always like to talk about money, those of us in public health, but it is important, right? We still need to make it. So in oral surgery and endo, it can be used for consultations. And before COVID, studies showed that there was no statistical benefit. You still need the patient to come in to get a root canal. But since COVID, since the shutdowns, we have seen a need, right? We have, if we could embrace the idea of doing limited exams, of doing post-op care using teledentistry, I do think that patients would be inclined to doing this. We have, Gen Zs and us millennials, we like our technology, and making it accessible, making it easier. I think it's better, is adaptation and better practice management. So pathology. There's also been a lot of studies on screening and consultations using teledentistry for pathology. Studies have found high accuracy in diagnosing pathology. There's a study done that was a oral surgeon who went to nursing homes. And so he had the aides take images of things that look suspicious and they were sent to him and he would diagnose. And I think of all the cases he had, maybe a couple were misdiagnosed, but they were benign. So they were insignificant diagnoses. It wasn't anything that was severely wrong. And then false negatives decrease with higher camera resolution, obviously. If you're using an intraoral camera, you're gonna have a better image. If you have a better image, you're gonna be able to better diagnose. If you're taking a picture with your cell phone camera, you might not have such a better image. Or if you have a really old camera, you might have an even worse image. So better camera quality, image quality equals better diagnosing. In pediatric care, it's being done, there's also been a lot of studies in this, diagnosing and screening. So I think what's really important is identifying next steps. So my son had this growth on his ear and I thought it looked suspicious. It was different colors, it was new, it was black and raised. And so I sent a picture of that to my friend who was a pathologist at UT. And she said, yep, that looks suspicious. You need to go see a pediatric dermatologist. And so we did, and we had a biopsy done. And so I couldn't get the biopsy done virtually, But what it did for me was it allowed me to have next steps, to know what was next. It allowed me some peace of mind. And I think patients are so information needy. We as a society are information needy. You're constantly Googling, people are posting on Facebook, they want answers to everything. But really they should be getting their answers from us. And so we can provide them the answers, especially virtually. But there's been a lot of studies. There's high accuracy between examiners of patients without lesions. So I like talking about next steps so you don't need to identify or treatment plan and diagnose exactly. You'll have a patient who has a cavity and you can identify this patient has a cavity, they need to come in and see me. Do you need to identify whether they need a filling or a pulpotomy? Maybe not. Whether they need an MOD or just an MO? No, but they need to come in to see you. And then once they're there, then you determine what they need. So there's high accuracy between examiners for patients without lesions. A lot of dentists are able to identify that patients don't have a need and don't need to come in. So interprofessional care is being used in emergency rooms. So right now, if you have a patient who comes in to an emergency room and they have pain, what are they going to do? Likely send them home or give them drugs, which we don't want. I had a patient who I was talking to him and I was like, so what do you do? And he's like, well, I do telemedicine research. And I was like, oh, okay, I do teledentistry research. And so what he did is they worked with ambulances and so a patient would call 911, they would send the ambulance. At the same time, they would have a physician on the phone. The physician would then identify whether that patient was truly emergent. If the patient was truly emergent, they'll put them on the ambulance and send them to the hospital. And if they weren't emergent, they would put them on a cab and send them to a clinic or a dental clinic. So people were calling the ambulance for dental pain. And I mean, it's kind of funny, but it's not, right? And that takes resources away. That's a burden on our system. People are going to the emergency rooms and not getting the care. So we could implement teledentistry in emergency rooms and then connect them to their nearest dentist so they can get proper care. It's being used in pediatrician offices. So pediatricians are now looking in the mouth. They're applying fluoride. If they're already looking in the mouth, they could take a picture and they could send it to their dentist if they saw something suspicious. Okay, so examples of interprofessional care. This doctor from Columbia University used it with AIDS orphans in Africa. They use it to monitor opportunistic oral infections that can serve as markers for HIV progression, especially because they didn't have the convenience or couldn't afford conventional testing. So in between them being able to get tested, they were screening the patients for progression. And I think that's just so innovative and wonderful. I don't know if Dr. Frey is on the call, but he's always trying to do something amazing. And he's trying to do work in hospitals, trying to determine whether patients might develop pneumonia after being intubated and giving hospitals intraoral cameras so they can help prevent that and communicate between dentists and physicians. So where can teledentistry be used? Well, it depends on the state. Obviously here in Texas, nowhere. But there are some states that will say that you can do it in people's homes. So you could do it in people's places of work. That's how I heard about teledentistry years ago, was I saw an ad looking for hygienists, I think in California, looking for hygienists to go to people's places of work to provide hygiene care. And I thought that was really interesting. I thought that couldn't be real. But that is a method that some states use. And some states, it's states restrictive. Some states make it that it's only in community health centers. It can't be in people's places of work or their home. But it's being used in prisons, in shelters, military bases. And so what are benefits of teledentistry? Obviously, increased access to care. But with increased access to care also comes earlier treatment, right? The sooner we get them in, if we make it accessible, the more likely they are to actually get the treatment. I'll say for us, or for me as a millennial, I'm more likely to download an app and buy something and have it brought to me than me to actually have to get my phone and call somebody. And so it is about accessibility. And maybe, the Gen Zs and the millennials aren't the ones we're going after, but they are a population we'll eventually care about, right? Everybody ages, everybody's young at some point. These all become vulnerable populations that we need to address those issues now. So interprofessional communication, right? Having all this information, all this data that we could collect and then share with other providers, so that we can provide better care for our patients, that we're all talking. That I think would be the ultimate end solution. And then a decreased financial burden on our system. I was at the Texas Oral Health Coalition. I don't know if this was 2 years or 3 years ago when one of the presenters said that there was 129,000 emergency room visits in Texas for dental related pain, which brings us to $200 and almost $51 million. For what, right? If they likely weren't able to get care, and likely got medication or pain medication, this is not the solution, right? Accessibility and access to care, that is important. Making it easy for patients to connect to providers, that's important. So they're not going to the emergency room, so they're not burdening the system, but also so we're actually providing care. So there's a 6-year study in California that showed that they used teledentistry exams. And what they determined was that 2/3 of children, so not all children, but 2/3 of children, half of seniors and people with disabilities in long-term care facilities can have their oral health needs met by dental hygienists in the community without the need to see a dentist in person, not seeing a dentist at all, okay? This is, yes, they have to see a dentist, but they could do it virtually. And they found that 2/3 of patients and half of seniors and people with disabilities could do this safely. They had no adverse outcomes in 6 years. It allowed for early intervention. It was less cost per patient because most of these patients were on state insurance. And it was a financially viable option. I'll say for me here, we serve 3 counties. We serve Harris, Waller, and Montgomery County. And those are really, really big counties, but I only have 1 full-time dentist. And cumulatively, they're really only 5 days. But there are 2 hygienists here. So we could have me in Montgomery or me in Waller doing preventative care where our patients actually are. And our dentists do the exams virtually and serve more people. The majority of our patients, they travel 40 minutes. Our patients walk here. And transportation is difficult. So if we really wanted to serve them better, we could have hygienists in these rural areas. And we have more rural areas than the areas that I'm in. And there's still a need where I am. And these studies are showing that we could do that and we could do it safely. So barriers, HIPAA, cost, licensures, billing, legality, technology. So we'll talk about some of that. So communication. If you're going to participate in teledentistry, it's important to have appropriate follow-up. So you had a patient send you an image. How are you notified that your patient contacted you? Or you have a patient who contacted you, you noticed and you diagnosed, and then who follows up with that patient, tell that patient what the next steps are. So making sure that whatever technology you're using has provider notification, but also that you're following up with your coordinator so that they're scheduling your patients. So next steps are happening and there's proper communication. Training. So there's been, in the states where providers can use teledentistry, there's a fear because they're unfamiliar with technology. They don't know what's legal, what's not legal. And next month we'll talk about more about those things, but really the best resource to know legality is your state dental board. They're the ones who can tell you. But now there's training. There are modules. When I was at the University of Texas, I did 2 studies where we did pilot studies with dental students and hygiene students. So we had dental students in one room and hygienists in another room. The hygiene students collected the patient information. There were case studies that we didn't actually have patients. And they sent that information to the dental student who then decided a few things. 1, did they need to be referred and they need to see a dentist? And then if they need to refer, to what specialty? And then could the hygienist provide preventative care that day? So could they do a prophy and could they do fluoride? It was that simple. And the students really, really enjoyed it. Did they struggle a little bit because they have to learn new technology? Yes. And these are people who are students and are currently having to do new things. So I can see how for a provider who's been out in practice for years, this could be a barrier for them. They're unfamiliar, they don't know new technology, what they should be doing. But there are trainings and that are happening, especially in schools. I know NYU is doing it. We're trying more and more. There are online modules that those schools can implement. I think they're free to make sure that the providers, when they graduate, they're competent in case they end up in situations where they do have to use teledentistry. HIPAA. So I will say this is the biggest misconception that happened from the shutdowns. So there was a national waiver on HIPAA requirements, but there are national laws and there are state laws. So you have to follow what's more restrictive. And if nationally there was a waiver, but your state didn't have a waiver, that means you still have to follow what they had in place before. And so then we had providers saying like, oh, you can use FaceTime on your phone, but they really weren't following their state guidelines. So for me, I think it's just better to be safe and just use a software that's HIPAA compliant, that's encrypted. PHI is important. You would want your PHI protected, right? So why not take those extra steps to make sure that it is? And technology is not that expensive. So patient information should always be stored and shared through a secure server, always. It's not texting through your phone, okay? It is HIPAA compliant and encrypted. Very, very important. Liability. So I've talked to malpractice insurance companies, and what I've heard is that they will cover you for anything that's normal and customary. So if you're in Texas and you're doing teledentistry, then no, they're not going to cover you because that's not normal and customary for us. But if you're in a state that does allow teledentistry, they would. And there was a study years ago, like decades ago, that said that dentists were at greater liability risk participating in teledentistry. But really, we haven't done teledentistry that long, and there haven't been that many people implementing it. So there's not that much data for you to truly say that you're at greater risk. So I looked at telemedicine research instead, because there is a lot more data on telemedicine research. They've done it more. And what they say is that you're not at greater risk when participating in telehealth or telemedicine, as long as you properly document. Just like you would when you see a person in person, when you treat somebody in person, you document same way, if not more. And if nothing else, if you have recordings of this information, you have more information to document with. So you're not at greater legal risk. And as long as you're providing the care that you're supposed to be providing and not doing anything abnormal, then you're not. Application for licensure. So there's no special license for teledentistry. Teledentistry is not it's just a way that we're providing care. It's not something new, but you do have to be licensed in the state that you practice in. So if you are in Texas, and if we could do it here in Texas, and we were in New Mexico, you would have to be licensed in New Mexico and be licensed in Texas. This is so that there is accountability, right? So if you had a patient who was in New Mexico and you were in Texas and you did an exam and something went wrong, well, the patient wants to report you, but you're not licensed in New Mexico, so they can't report to the New Mexico board. But then they go to the Texas board, and the Texas board is like, well, the treatment wasn't done here in Texas, it was done in New Mexico. So there needs to be safeguards. You have to be licensed in both states. There's argument that if, let's say you have a patient of record who was from your same state, and then they went on vacation somewhere else and you need to connect with them virtually, even though they weren't your state, then that would be okay because they're already a patient of record in the state that you live in. But that's a little bit of gray area. And so almost done, okay? And I'll answer your questions, but technology. So I won't talk about specific technology, but I'll tell you what I look for. Make sure it's a reputable company. There's been a lot of companies coming out during the shutdowns who are trying to make money, right? They see this is an area where I can make money, so I'm going to invent a telehealth company. And I would go with somebody who's reputable. Make sure that you're protecting PHI. I like that it have a patient portal, so that way you can connect directly to a patient. Prior to COVID, there wasn't that many providers wanting to connect directly to patients, but I think that now there are those wanting to connect directly to patients. So having patient portals where a patient could upload information and then contact their dentist. Screen sharing. So if you're trying to talk to your patient, good for OHI, right? You want to be able to share your screen and show them what you see. online, offline modes, so especially for those of us in rural areas, so that if you collect information and you don't have access to internet, that you can upload it later. Intraoral camera integration. So when I was at UT, I was on a committee for telehealth software for the entirety of UT Health Houston, which is really large. And really my basic question to all these amazing companies who had all this technology and were reputable was like, can I connect an intraoral camera? Because if I can't connect an intraoral camera, then you're really going to limit me. So if you're going to buy a telehealth software, just make sure that it integrate an intraoral camera. And then make sure that it has synchronous and asynchronous capabilities. Okay, so now I'm going to look at your questions. Maybe.
Well, I can help you out with that. I saw one from Mariella Leba from New Mexico asking if there are restrictions for prescribing pain medication through this avenue.
Okay, so there, and we'll talk more about that. So there was also a national waiver on that. So let me look real quick. I can't remember off the top of my head, but there was a national waiver that said that you had, I think you have to do it synchronous. So you can't do asynchronous if you're going to prescribe. One moment. Yeah, so the DEA said it has to be for a legitimate medical purpose, obviously, right? And you have to communicate through audio-visual, real-time, two-way interaction. Initially, when the shutdowns first happened, they said you couldn't prescribe. But now if you do those things that are real-time, two-way, so synchronous, then you can. And then they remind you to, again, follow your state laws. So if there's restrictions, I don't know New Mexico law specifically, if there are restrictions in New Mexico, then you need to know those. And if New Mexico says no, then it's a no. But federally, nationally, they're saying that yes, you can. Oh, hey, my friend Jamie is on. I see people on here that all my friends are on.
They are, you have quite the following. Let's see, Mariella again added excellent presentation. I will walk away with a much better knowledge of teledentistry and ways to incorporate into any work setting. So thank you. Great information, Amber. Will your flow chart be available?
We can make that available, sure.
All right. So we can maybe put that on the website where people can download it from there, maybe?
Okay, that sounds good.
Okay, great. Let's see, we see a couple of hands raised. Do you want to, I'm trying to see who we need to unmute. Well, if you can type your questions in the chat box, that would be very helpful. See if there's any more coming in.
Yeah, I can put my email in the chat if people have questions too. Says will your flow chart be available email address? I can give you email address. We can do that. Yeah, you know, during the shutdowns, I had a lot of dentists call me. I don't know how people get my phone number. I must be on the internet somewhere. A dentist asking me about teledentistry, which is kind of nice. People just randomly calling me. So yes, you can have my email address because apparently people have my phone number. So I enjoy talking about teledentistry.
That's good. Well, it was a very, very informative webinar. Are there any other questions or any other comments that someone would like to put into the chat box?
And so next month, we'll talk about legislation, what legislation we could potentially pursue, language in different states. I think good practices for language to include, safeguards that we can have, supervision laws, other things to consider if you're trying to do teledentistry in your state. If you're trying to identify whether you can do teledentistry in your state, we will go through those steps. And then again, hopefully in March, we will have something to review here in Texas. I mean, that would be amazing.
It would be. We look forward to that. Let's see. I see another chat. Great job, Amber.
Oh, Marion, our president, TDJ president.
That's wonderful. Let's see. I see a few more chats. A lot of thank yous and great information, and it was very, very informative. I really would like to see. You know, it's a shame that we weren't able to get at least not just the exams, but the screenings and some of what these other states had. Do you know if anyone is working on anything teledentistry in our state?
I believe the TDHA, the Hygiene Association, is working on something. So if you're a dentist or a hygienist interested in supporting this, I would contact TDHA, I would contact TDA and let them know as well. I think they might be collaborating, I'm not sure. But I know there is a pursuit because I know there is a need. I know there's a lot of dentists who've contacted me wanting this. I get definitely more dentists talking to me about it than I do hygienists, although I am a hygienist. So there is a want, the desire, and there is absolutely a need in our community. Texas has a lot of rural areas, a lot of impoverished people who could use this. But even if it's not, there are patients who could use this who are just in our community.
Well, like you said in your presentation, the consultations, the post-op, all of that, when you have to drive 2 hours just to have a post-op, look-see, visual.
Exactly, a look-see.
Well,
no more look-sees.
Exactly. It just saves so much more time for the doctor and the patient, and
it
expense.
does.
So
it does.
It would be so helpful. But thank you, Amber, so much for your time today.
So much.
Thank you all attendees for joining us. If you have any questions, please send us an email. Don't forget to submit your evaluations. So thank you all again and have a great day.